Assalamu alaikum. Today we will talk about how to diagnose acute headache. If you are a medicine physician and working in internal medicine department or emergency department, most of the patient present with acute headache. So today I will tell you how to diagnose acute headache while following this algorithm. So firstly we divide the acute headache into three types. Either it is a hyperacute headache or it is acute single episode the patient has acute recurrent episode. Let's suppose patient present with acute headache and the acute headache is hyperacute. So what we can do now is to do the CT scan, of the patient and do the lumbar puncture in order to rule out the other patient is subarachnoid hemorrhage or not. So you do the CT scan and lumbar puncture. This will tell you the patient is subarachnoid hemorrhage. Hyperacute headache is a thunder type of headache, which we can also call it as a worst headache of the life. So subarachnoid hemorrhage is because of two reasons. Either there is a bleeding AV aneurysm or there is a rupture Beery aneurysm. So either there is a bleeding and AV malformation or there is a rupture Beery aneurysm. This is a hyperacute headache, so you can do with CT scan and lumbar puncture. Second thing is patient present with acute headache, but this is a single episode. So we will proceed like this. The patient is either a history of trauma or not. If the patient has a history of trauma, we divide into three parts. Either the trauma history is associated with fever or there is no fever. Let's suppose patient is acute single episode and patient has a history of trauma and that is associated with fever. We will check the knuckle rigidity. If the knuckle rigidity is present, we can say that it is meningitis. If the patient is acute single episode with no trauma and the fever is present, but the fever is also associated with altered mental state, if there is any seizure episode, we say that it might be because of encephalitis. A patient has acute single episode with no trauma and a history of fever, and there is associated if there is a pain pressed over the forehead. अगर आप if there is associated pain and you press the patient over the maxilla and frontal foreheadache, so the patient is also the pain is worsening on bending forward. We can say that is acute sinusitis. So this is a single episode of acute headache with no trauma. Let's suppose the patient is a acute single episode with no trauma and no fever. What we can do is to refer the patient to the eye department for fundoscopy. What we will see in fundoscopy is papilledema, flame-shaped hemorrhages, and retinal hemorrhages. If all these things are present, we will check the BP of the patient, and we will see the BP of the patient is raised. It's mean that the patient is acute severe hypertension, and we will consider the eclampsia, acute renal failure, and pheochromocytoma. So we will work for the eclampsia, acute renal failure, and pheochromocytoma. This is acute single episode with no trauma. Let's suppose the patient present with acute single episode with trauma. We will check the patient as a recent trauma. We will suspect the two different pathologies, like either this is epidural hematoma or this is subdural hematoma, and we confirm the epidural and subdural hematoma through CT scan. Let's suppose you have done the CT scan and it come out normal. What you will consider now is either it is concussion injury or it is either post-concussion syndrome or it is either cervical sprain. These are the acute single episode with trauma. You consider the epidural or subdural hematoma. If the CT scan of the patient is normal, we will consider either it is concussion, either post concussion syndrome or cervical sprain. The third, which are most important, is the patient present with acute headache, acute, but the episode are recurrent. What you will suspect in this case is, which is most common things, that a patient is acute recurrent episode of headache. You will check the patient is nausea or not. You will check the patient is photophobia or not. You will check the patient is phonophobia or not. If all these three symptoms are present, you will now check for either aura is present or not, or is there any focal neurological deficit or not. If patient is acute recurrent episode with nausea, photophobia, and phonophobia, and aura is present or the aura is absent, we cause it is a common classical migraine headache. If the patient is acute recurrent episode with nausea, photophobia, and phonophobia, but there is a neurological deficit, we say that it is a migraine complicated. It is a complicated migraine. Same as with acute headache with acute recurrent episode. and there is associated excruciating unilateral pain. Patient presented with you with acute recurrent episode, but the pain is unilateral on the one side and it is too severe. We can classify it into the two steps. Either these associated cruciating unilateral pain is associated with epiphoria, rhinorrhea, red eye present or not. If all these things are present, we call it a cluster headache. If let's suppose epiphoria are absent, rhinorrhea are absent, red eye are absent, and pain primarily in the second and third cranial nerves, we call it trigeminal neuralgia. So this is how you will approach to acute headache. So shortly I will tell you very quickly that acute headache divided into hyperacute, acute with single episode, and acute recurrent headache. Patient with acute headache with hyperacute, we will rule out the subarachnoid hemorrhage. Subarachnoid hemorrhage because of two things: either there is malformation, AV bleeding, or there is a rupture of Berry aneurysm. Patient is acute single episode, we divide into three things: either it is a trauma or not trauma. If patient is no trauma, we will check either fever or not. If there is a fever, we check the nuclear rigidity, it is present, it is meningitis. If there is no trauma, fever is present, altered mental state plus seizure, it is called encephalitis. If patient is no trauma, fever, endoscopy, we will check for the severe acute hypertension, we will rule out the eclampsia, we will rule out the pheochromocytoma, and rule out the acute renal failure. And the third thing is patient acute single episode, we will check the trauma. Patient has a history of trauma, we will do the CT scan and suspect the subdural hematoma and extradural hematoma. If it is not present, we will suspect S concussion, or it is a post concussion syndrome, or it is cervical sprain. And the third thing is acute recurrent episodes. An acute recurrent episode is three things like episode of nausea, photophobia, and phonophobia. We will divide into two things: either it is a neurological deficit are present or not. If neurological deficit are present, it is a complicated migraine. If neurological deficit are absent, we call it a classical migraine. And the classical migraine is associated with either present with aura, or there is aura is present, or aura absent. So the third thing is acute recurrent episode. Check is either unilateral symptom or not. If the patient is unilateral, very severe symptom, we can go to check for either it is trigeminal neuralgia or it is cluster headache. So for the cluster headache, we will check for the epiphoria, rhinorrhea, and red eye. If these things are present, we will call it that is cluster headache. If the patient has no rhinorrhea, no epiphoria, and no red eye, and there is only pain at the second and third division of trigeminal nerves, we will call is trigeminal neuralgia. Hope this algorithm help you and help you to diagnose your patients. And we will talk further about how to manage this type of headache. Thank you so much.